I'm working actually in a supportive care department, so like palliative care. And we see patients every different type of cancer. I work on a med-onc floor, so med-onc and surgical oncology. So we see solid tumors. So we see everything. I've rotated through quite a few specialties, which I really enjoy doing because, like I said, I'll see every type of cancer patient in my particular department.
Welcome to MDF Instruments Crafting Wellness Podcast. I'm so excited today to introduce you to Emily. She is a travel nurse in oncology.
My name is Emily. I go by That's Spitfire Nurse Em on Instagram. I am an oncology nurse. I do outpatient clinic nursing, and I've been an oncology nurse for about 4 years now.
A pretty serious nursing specialty. Can you tell us a little bit about what drew you into oncology nursing specifically, and why you chose nursing, and why you're a nurse, and just how you kind of just came to this career path?
Yeah, of course. So I kind of took the long way around to get to nursing. I did nursing as a second career. So originally, I did undergrad, and I thought I was going to go to med school. So did all the classes for med school, and then I worked in emergency room, and I did not like the way doctors treated patients. So I ended up talking to my dad, who asked me like, "Do you really want to go to med school? Like, can you give me a good reason?" And I couldn't. And he always kind of pushed me towards the nursing route. So I decided that after working in nursing, I was like, I want to be a nurse. And honestly, I feel like the heavens like opened up. Like it was a great decision for me. And I did Duke's ABSN program in North Carolina. And also, ironically enough, I was like, I can't do oncology. Oncology is too hard. I don't have the heart for it. So my program was about 4 semesters. In the first semester, I was like, I don't want to do oncology. I want to do nursing administration. Like that's where I see myself. And then as I went through my program, I realized I really liked talking to patients and learning their stories. And I was like, you know what? Let me challenge myself and pick oncology. For my capstone, I kind of had a choice between oncology nursing. That was my top choice, and then my second choice was like the cardiothoracic ICU. So very different spectrum. But honestly, I got oncology and I loved it. I think, it does take a special person to be an oncology nurse. I think it's more of a calling than I feel like other specialties, maybe pediatrics, but I don't know, like I fell in love with it when I started there as a student on my floor. I really I'd always had an interest in palliative care as well. And oncology and palliative care go hand in hand. So I really liked, being able to, see patients at end of life, because that's kind of where my heart lies. I really like palliative care, hospice, end of life, and it's funny. Like I can't see myself doing anything else. Like I absolutely love what I do. For all the reasons that people say oncology nursing is hard, are the reasons I absolutely love it. It's my preceptor when I started told me, she was like, death for these patients is a total release of suffering. Cancer is one of those diseases that causes unimaginable suffering. And for them, a peaceful passing is a blessing. So ever since, she told me that, it kind of changed my perspective. And, now like I see myself going into palliative care as an oncology, like nurse practitioner, and, helping patients decide, helping them pass peacefully, and pass where they want to pass. So kind of a long-winded answer, but yeah, like oncology nursing is definitely, it's a special type of nursing, but I think it's so underappreciated. And it's amazing.
Yeah, I imagine that it's not the easiest of specialties, just because I know that you probably have harder days than like a different kind of specialty in nursing, where it feels like they could probably go through several shifts and not have a death. I imagine for you it's a more common thing in your life. Would you say that's true?
I think so, and I think it's different now that I've shifted into the outpatient setting. In the inpatient oncology, at least in like the medical oncology, you see a lot of symptom management. You see patients at their worst. They're only admitted if they can't manage their symptoms outpatient. So being outpatient has been very very different. We see patients from time of diagnosis all the way to either, survivorship or, unfortunately, like hospice. Um, but outpatient has been awesome because there's a lot more, you see a lot more positive stories, people like, being able to ring the bell when their cancer treatment's over, and like graduating and going from, being a cancer fighter to a cancer survivor. And that's, that helps balance out because you see a lot more of those cases outpatient than you do the opposite. So
So
it's been a nice balance.
that's awesome. So for everybody who doesn't know who's listening or like me, can you explain the difference between outpatient and inpatient and how that changes depending on, does that change where you work then? Or are you still like, are there outpatient in the hospital still? Is that how it works?
Yeah. So inpatient is like traditional bedside nursing. So usually like 12-hour shifts, what you typically think of as like, being a bedside nurse. Um, Outpatient, you have a lot of different options. I work in a clinic, so I see patients one-on-one with the provider. We see patients in clinic. I handle phone calls, all that jazz. And then there's also outpatient infusion, which is kind of like an intermediate between um, bedside nursing and outpatient, clinic nursing, because you're still doing a bunch of skills. You're um, administering chemotherapy, a bunch of, like electrolytes, blood products and whatnot. But you're not, you're working different hours. You're working outpatient hours. So 410s, 5/8. The lifestyle, I think, if you're kind of moving towards like, um, I don't know, like retirement or whatever, you're like you see a lot of older nurses in the outpatient setting because it's a better lifestyle. If you're working, you don't work nights, you don't work weekends, you don't work holidays. So it's a very different lifestyle. It's a very different type of nursing, but for me, I like it because I like talking to patients. That's why I pick nursing. Very good, like people nurse.
When we're in the hospital or we need care, we're scared and feel alone and afraid, like all of those things. So having someone calm us down or relate to us or make us feel like it's going to be okay, I mean, I think that's the most important thing. And that's why I love nurses. That's why I have like such an affinity for you guys, because I think it does take a really special kind of person to get into nursing. I think you guys are really empathetic, you have big hearts, you want to be there for people during their most vulnerable times. And I think it takes a really special soul. It's really not an easy thing. ER setting, you could have a nurse that's like, okay, they're having to work weekends or they're having to work holidays and that kind of thing. And maybe in an outpatient situation, you're not doing that, but you have other issues and stresses that you're dealing with that kind of compensate for maybe the schedule that's a little more normal stress level, I imagine, and just the things that you have to go through and see and witness and help with as that kind of nurse, I'm sure can be daunting. So I wonder for you, but we're always talking about mental health because like I said, you guys it takes a certain kind of person to get into healthcare. So naturally empathetic, generous, all of that. It's an easier position for people to take advantage of you
Sure.
because you're in a position of service. And in that kind of way, they're on medication, they're not themselves all the time. And I know that especially healthcare can take some abuse, both by patients and also by staff. So I just kind of wonder how you manage just the stress of your career and able to like stay so positive and keep going through all those hard days.
Yeah, I mean, so for me, I am very good at compartmentalizing. So, when I go to work, I'm there. I'm very present. Like I always say that the moment I swipe in is the moment I'm 100% like or 110% present for my patients. I will give myself freely. But the moment I swipe out, it's me time. I 100% leave work at work. And I'm fortunate to be in a career I can do that. Even if I have, like tougher patients, which, or sadder cases that I dwell on, I give myself some time to reflect. And usually it's on the car ride home. And then when I get home, when I walk through my door, I don't think about it. And I've done that pretty much for the past 4 years. And it's really helped because, we do see, a lot, you are participating in other people's lives. And you see them, especially with oncology, you see the worst, people at the worst. Cancer is one of those diagnoses that, is life changing. And I've seen even like the most stoic, like strong of men, they'll crumble down. you know?
Mhm.
So I definitely, leaving work at work is very important to me. And then, the time I'm home, my best friend, my roommate's also a nurse. We're able to converse, and kind of share stories if we want to. But if not, we usually just we hang out, we'll walk the dogs. We don't do anything healthcare related. Um, and also like, you know, we do deal with quite a bit at the job, with abuse and whatnot. But for me, unless a patient physically lays hands, that's different. But if they're frustrated, I get it. At the end of the day, I get to walk. I get to go home. I don't have cancer. I'm very fortunate, and so I can empathize with these patients. I'm like, you know what? And most of the time, they'll apologize, like, I'm so sorry, and I'm like, it's okay. Like, I get it. Like, it's a terrifying diagnosis, and that fear of the unknown can change people, and can make them act out in ways that's not normal for them. And typically, you give them time to vent, you give them time to give them their space, and they'll come back, and they'll apologize. But for me, yeah, being empathetic, putting myself in their shoes is really helpful. And I don't know, like, ever since COVID, like, I like started doing these TikToks, just to like distract people.
Mhm.
There was again a lot of fear of the unknown among staff, and I think that kind of just like evolved. And now, like, I do a lot of posts about, like, just being upbeat and enjoying yourself. Nursing is one of those careers that it's so difficult. So you have to make time for yourself, and you have to enjoy, make fun of yourself. You know what I'm saying? And I'm a terrible dancer. That's doing those TikTok videos. I was like, I'm terrible, but if I can make someone laugh, that's the best thing for me. So even at my own expense, that's totally fine.
Spoken
Yeah.
like a true nurse. No,
Yep.
it's funny though, because honestly, I find the trend really is they always have a creative outlet, whether it's, social media and finding TikToks or blogging or writing or dancing or singing or acting or whatever it is. There's always a creative outlet, because I do really think that there is something to that where it's like you have this creativity in you as well, that needs to come out, and it's such a great healthy way to express it, about where you're saying, sometimes I need the car ride home to process the day. And I think that's really smart. And you're like, but once I get home and I walk in that door, like, I leave work where work is, and I'll pick it back up the next time I'm there. And I think that's a really brilliant way, because what a great way to kind of decompress. And gratitude is something, another thing you're touching on, which I think is so important, to just remember how good we have it. I think it's a really great way to kind of bring yourself back. I still feel like, I can relate, because my dad right now, he's fighting cancer, and he's actually in the hospital. And he's
Sorry.
yeah, it's really rough. But like the last 2 days, he's been hallucinating,
Mhm.
and he's doing crazy things that like my dad would never do. And I guess like last night, in the middle of the night, he thought he was in war. And so he thought he had been shot. And so he's like hallucinating and like yelling at. I'm like, wow, my dad is like the most docile, person. Like, he would never, um, be irate to people, or like, it's not like him at all. But like you were saying, when you have cancer and you're fighting for your life, and you have all these medications you're on, and things interact with other things that people are taking, they're not themselves. But at the same time, I still really feel like nurses and healthcare workers in general, you guys do get a lot um, of that energy that's hard. It's not personal though. And it sounds like that, that at the end of the day, it's not personal, and it's not actually them attacking you, verbally or whatever it is. It's just they're sick, and they cannot act like themselves. But I just think it's important to kind of touch base on the fact that, one way, I can understand why it's happening, but at the same time, it's just not okay. A lot of nurses getting, sometimes accidentally hit, maybe, or maybe on purpose, or, just all kinds of crazy things happen to you guys. It's a real thing that nurses go through, that is just not, not good.
Yeah, I mean, it's tough, right? Because it's a lot of time these patients are confused, and being in a hospital, does not do anything for their confusion.
Mhm.
Um, I've been choked, I've been punched. It's a potential of the job. I don't think it's part of the job, right? But I think I take more issue with like the verbal abuse. Because unless a patient is like blatantly confused, I've had family members cuss at me, like
Mhm.
denigrate me, and there's no reason for that. I always say, like, if I were on the street, right, if we were not in the hospital, I wasn't wearing my scrubs, would you talk to me the same way that you're talking to me right now? Right?
Mhm.
I feel like, there's a fine line between, advocating for your family member, if you're there advocating for yourself, versus just being outwardly rude.
Mhm.
And I always say, like, I work for the hospital, I don't work for you,
Mhm.
right? I'm here to help you, I'm not here to serve you. And I
Mhm.
think a lot of, these hospitals now are so focused on customer or patient satisfaction scores, that they're less concerned about their staff, staff satisfaction, right? Because
Mhm.
I think, yeah, it's part of like Medicare and Medicaid. It's all about money. Ultimately at the end of the day. So it's a shame. It's like there have been so many bills, put forward, to protect healthcare workers. Healthcare workers have died. We've been seriously injured, have died on the job.
Mhm.
Especially my colleagues in the ER. They really get the brunt of it, both physically and verbally, and it's unacceptable. With mental health issues being on the rise, some people can't, they can't help it, right? Their mental illness is a killer, especially untreated mental illness. We, as much as we want to help these patients, we can't. We can't monitor them all the time. We can't force them to go to rehab. We can't do anything. We can lead a horse to water, but we can't make them drink.
Mhm.
So I think this is a very it's a multifactorial issue, that I think, where a lot of healthcare workers are speaking up, about. And I think, um, you know people have to take a notice. So, because people won't tolerate it anymore. I think COVID really was like the straw that broke the camel's back. Some healthcare workers were literally, putting their lives on the line for their patients, and hospital administration, like, didn't do anything to reward them, or to, like, we were called healthcare heroes, but we were treated like zeros. So there's a fine line. Like, I obviously I want the best for my patients, and I want them to be safe, and I want them to, to get better. But I also am, I'm not willing to tolerate the abuse that comes with it, and I'm not sure if there is a good answer. But I'm just glad there's a lot of talk about it right now. And it's a hot button issue. So
Yeah, I think like it's important to talk about because if we don't talk about it, we can't change it, we can't fix it, we can't help it. But I just think people need to understand and know that it's happening because I think what happens is there's maybe some protection there of maybe the patient more than the staff. Oh, excuse making excuses, justifying it, all of these things. It's like, oh, it's okay, just move on. I don't want to talk about it. Let's just get to the next thing. But the problem with that is that when we don't talk about it, then we can't, people don't realize how common it is. And
right,
and you think you're the only one, just happened to me this week, but it's fine, let's move on. But really it's a lot more common than I think people even realize because once they start talking to each other, it's like, oh wow, yeah, that happened to me yesterday too. And this kind of behavior, because there needs to be protections put in place or some kind of way to help advocate and protect the healthcare worker. You're there to help, but you're not there to take abuse and be mistreated. And it's like there is a fine line between understanding like, okay, someone's mentally ill or they're not themselves right now, they're on heavy medication. There are these conditions that make you understand logically what's going on, but at the same time, would they be talking to the doctor like that? It's a respect issue, and I think if the hospital or place is not requiring people to be respectful, then you're just kind of leaving it up to them to have to decide when they're going to be respectful or not. So it's just good to talk about because it's not okay and it's not fair. Can you walk us through a little bit? I know you did a little social media post on it, but can you walk us through like a typical day for you and are you working Monday through Friday? Is more stable hours? Can you tell us a little bit about what an oncology nurse day like is for you in the outpatient infusion?
Sure. So my hours are 8 to 4:30. I work 5/8. I've also worked 4/10s, which I prefer.
Mhm.
But yeah, so pretty much my job entails, if I'm seeing patients, so we'll have clinic days and then we'll also have like admin days. During a clinic day, which are the majority of the days, we will see patients from 8 to like 3. And then, so it's usually the team is the nurse, the provider, like a doctor, and then we have a mid-level. So either a PA or an NP. And so at my current facility, we see all the patients first. So the nurse goes in, talks to the patient. We have a questionnaire. We just make sure they're doing okay. Ask them usually how they're tolerating their chemotherapy or their radiation, if there's any concerning issues, and then we go back, talk to the doctors, and then they go in to see the patient. And that kind of goes, throughout the day. And we do that just so the doctor can focus on really what matters, what the patient, how they're doing versus having them having to ask all the different questions. And then when we're not seeing patients, we get a lot of phone calls, a lot of symptom calls. There's a lot of symptoms with chemotherapy, and radiation, and we encourage our patients to call because sometimes these symptoms can be either a sign of like a potential allergic reaction, or something that if it's so intolerable, it means that we may have to change the dosage. So answer phone calls, answer messages, and then if I have downtime, like this clinic is awesome. All the nurses and the providers are in this one big floor, so it's cool. I can chat with the other teams, you know, and just hang out. So there is not a lot of downtime, but there is just enough to get to know everyone who's working there. So it's good.
So I have a question about oncology nursing for you specifically. I'm just trying to understand it. Do you treat them like all different kinds of cancers, or are there certain cancers that are coming to this outpatient facility where you're doing this?
But I'm working actually in a supportive care department, so like palliative care. And we see patients of every different type of cancer. But the clinic, I work on a med-onc floor, so med-onc and surgical oncology. So we see solid tumors. There's another floor that deals with radiation oncology patients, and then another floor that deals with blood-based cancers. So we see everything. I've rotated through quite a few specialties, which I really enjoy doing because, like I said, I'll see every type of cancer patient in my particular department. These doctors, the providers that we're working with are top of their game. This is the #1 cancer hospital in the world. So these doctors are awesome, and it's a great, they're always willing to teach, and the nurses there, also top notch. So it's cool. It's a great learning environment. I'm kind of nerdy like that. I like to know everything about these cancers. So it's fun to ask, and they're obviously very passionate about it too. So they'll talk your ear off, and I love that.
Yeah, and I imagine with your specialty, you're also getting to know your patients pretty well, right? Because I think typically, like if you're in ER nursing or something like that, like a patient comes, they might stay in the hospital for like a week or something, and then they're gone.
Right.
But with what you're dealing with, I imagine it's more several week process through radiation.
Generally, the process is we see them as a new patient. They establish care with us, and then we deal with the chemotherapy. Like I said, radiation is is a whole nother area of oncology nursing, which is exceptionally fascinating. But I actually just am starting to learn about. But so yeah, we see them, every depending on what their cycle of chemotherapy, how often they're getting it. We'll see them, every 2, 3 weeks, maybe even every month, just to check in, make sure they're doing okay. And then, when they finish treatment, depending on what order scans, I'll make sure they're doing okay. And then as if their cancer is responding and doing well, then we kind of increase that interval at which we see them. But for the first from time of diagnosis, we see them pretty much like 2 or 3 times a month.
Got it. Yeah, wow. It's got to be rewarding too to just see like the start of the journey of like, okay, I have cancer, and how are we gonna navigate this to the end of like the ringing the bell to like, okay, I'm a cancer survivor now, and like hopefully I won't go into remission, and just like seeing the whole process of the
Right.
start to the finish has got to be really rewarding.
And it's very, it's super emotional. Obviously, like, I've worked in both like I've worked in a breast oncology clinic, and these most of the time these cancers are caught pretty early. So but it's an emotional time, like no one wants to be told they have cancer, no one wants to be told they have stage 4 cancer, so it is emotional, and it's also emotional like towards the end, it's either, as they graduate, or, them being told, I'm sorry, like we've reached the end, the limit of the treatment options that we have.
Mhm.
So it is a very emotional journey. And, like I said, even the most stoic, stubborn of patients, they'll break down eventually. So it's interesting to see, how they, their journeys and their course. And, in clinic, we see patients, throughout their cancer journey. Um, so, you get to know them pretty well. You get to know, like, oh, they come in, you're like, they don't look so good. Like, they're not acting themselves. Or, wow, you look great. Like, and, you see the patients that lost their hair through their treatment come back, and they their hair is growing back. You're like, wow, like, it's like you look like a different person. So it's cool.
If you could go back and tell your younger self some piece of advice, what would it be? Do you have anything like inspiring that you could, that, or something you wish you knew you had known, that you know now? Anything like that?
I think, on it, as corny as it is, like, to not be afraid to kind of break out of your shell. I used to be this very introverted, very shy individual, and now, I'm a completely different person. And I think, nursing was kind of something that I kind of, if I'm going to do this, ended up loving it. Oncology, I was like, I don't know if I have the heart for doing this. I love it. And then, being able to travel nurse, kind of helped me really break out of my shell, like socially. I'm super extroverted now, but I used to be like really not. So definitely just like continue, like, don't be afraid to step out of your comfort zone, because honestly it's done nothing but wonders for me.
Are you still travel nursing now, or are you more settled in Texas?
Yeah, so I did travel nursing for a year. It's actually where I found outpatient nursing. I did 6 months in New York City, and then 6 months at a small clinic in Winston-Salem, North Carolina. And I really enjoyed it. I just got fed up with agencies. They're very shady, and I did not like that. So I was like, I knew as an oncology nurse, MD Anderson is number 1, and I was like, I would love to work here. So I applied for a staff job, and honestly, I'm so happy. Like, I'm so happy. I love Houston. I love being here. I love MD Anderson. And yeah, it's weird going back from, like, being a staff nurse, but I think being a travel nurse and having, being exposed to so many different things, and, being put in like any scenario and having to adapt quickly has really helped me here.
Mhm.
You know, they can put me pretty much anywhere, and I'm like, what do you need me to do? So that's helped. And, I'm very grateful for my travel experience.
Great. It's great advice. It's almost like studying abroad, kind of when you're in college. I feel like everybody should maybe go travel nurse for just a year just to
Yeah,
see what it's like, go somewhere new, step into different roles, but you really have to be on your feet.
totally.
But it's funny that you're talking about the whole agency thing, because I just did a podcast with a travel nurse about that. And it's pretty crazy to think about what the hospitals are billing, and then the agencies taking money but not telling you how much they take. Like, and just the fight for that, like, it sounds very shady, and like another thing that we need to change as far as
Yeah,
moving forward with transparency and fees and things like that.
totally.
Yeah, so what do you do for fun? Have you found some interesting things in Houston to do yet? Have you been able to kind of like translate that into this new place that you're living? I know you said you had a dog, so what do you like to do for fun?
So one of the reasons I went to travel nursing is because I like to go out to eat, explore new restaurants, and bars. And, Houston is a great foodie city. So many restaurants, so many bars. So I've been enjoying going out, in the weekends with, with my roommate, and meeting new people. Obviously, like walking the dog. The dogs love it here too. So it's, yeah, just trying new restaurants every weekend. That's what I've been doing.
I'm such a foodie too. I absolutely love food. I love, like, I'm on Yelp, I'm on Google, I'm trying to figure out, okay, like what's really good to eat. I'm all about trying new things, but like finding the homemade version or this like yummy new drinks or spots. So I totally feel you on that. And there's a lot of great food. A lot of good Mexican food too, I feel like.
Oh, definitely.
Who inspires you in your life? Who if you kind of like look up to and kind of want to emulate?
There are two people. They're both very, very close to me. My mom, and actually my best friend. And oddly enough, their personalities are pretty much the same. I think that's why I'm so close to my best friend. But for my mom is the most patient person that I know. She kind of taught me to be, to be very respectful. Same thing with my dad, but she's also, taught me a lot about empathy, which obviously, that's the most important part of my job. It's really why I'm good at my job. So I'm definitely grateful for her. She's also, super selfless and caring. And then my best friend, Emily, who, she's been, she's in my Instagram as well, but she is probably the best nurse that I know. She's a pediatric oncology nurse, but she is, if you like, an angel on earth, just a very selfless, sweet, just like kind-hearted person. I actually hated her when I first met her because she was so nice that I thought she was like so fake. But come to realize though, she is a very sweet person. She's very bubbly and outgoing. I think she kind of helped, bring that out in me. She's the other half of my tattoo. We're yin and yang, opposites, but very much, complement each other perfectly. And she inspires me to be a better nurse every day. Her patients love her. She's a pediatric oncology nurse. Like, I've always had respect for pediatric nurses anyway, but pediatric oncology takes a very special person, and she loves her job. She's very, very, very good at it. She kind of put herself out there, and she's been excelling. And it's great to see her every day. Do what she does and do what she loves and enjoy it. So
I love that so much. So how did you guys meet? Did you meet in school, or tell a story of how you guys met each other?
So we actually met on our first job. So we had both graduated from nursing school, and started on the same floor together. And I started about a month earlier than she did. But then we kind of grew. We did a lot of orientation together, and then we became really close friends. We started hanging out, and then now, like, pretty much inseparable. I call her like my life wife. She's here in Houston with me, obviously. I've been living with her for the past year and a half or so. But yeah, no, it was like we hit it off, and like, yeah, literally like stuck together since.
I love that so much. And it's really important to have, I think, in anything that you do in life, just to have friends, someone that you can trust and turn to and confide in. And the fact that you are both in nursing and you're both in oncology, with the difference being adults versus pediatric, is just got to be such a nice, like, common baseline to that you can understand each other, understand the kind of days you're having, be there for each other, and then also know when, like, to be quiet, also know when, like, okay, I don't want to go there today. But I think it's so special to have that support, and I'm so glad that you have that. We should get her on the podcast too. I think we should do like a double podcast and have the two besties on, yin and yang, and
Totally.
talk about oncology nursing. And she sounds amazing. So I mean, love
I actually gifted her a pediatric NDS stethoscope, so first got her job.
Good. Yeah, we're gonna have to get her involved now, because I just think like what you guys do is so important and so special. And appreciate you guys both so much for what you're doing out there in the world, just making it a better place and bringing health to people, and hope and patience and kindness and love and all the things that our world needs more of. So thank you so much for doing what you do.
I love it, and I wouldn't do anything else.
I know you're on Instagram. I imagine TikTok with the dance moves. We were talking about that. Yeah. So go ahead and drop your social handle for anybody who wants to come take a watch of take a dance lesson from you, or She posts all this stuff on like what the day in life is like. She's constantly giving knowledge, advice, everything on her social media. So
So yeah, my Instagram is that Spitfire Nurse M, which is definitely a accurate description of me. And then my TikTok handle is mjamie, EMJAYMIE.
perfect. Yeah, I was gonna ask, why do you call yourself a Spitfire nurse? That Spitfire nurse. How did that little nickname come to be?
So I used to be like very soft spoken and not kind of like, I would never stick up for myself, and then became a nurse. And I've been told, I mean, I've gotten in trouble for yelling at people, particularly residents, just, for all in like, to defend my patient. I never speak up unless A, I know I'm right. And
Mhm.
B, it's to defend, to protect my patient. And, the times I have spoken up, yes, like could I have done it in a better nuanced way? Yes. But at the end of the day, like I did what was right by my patient. So I don't regret it.
See, there's the empathy of it again, though, because it comes from like you're sticking up for other people. You know what I'm saying? Like you even said, like, oh, when it comes to my patients, like protective, like I'm coming in there and I'm gonna say something. And it's like, but we need to also learn how to, because I'm the same way. If someone is like hurting a friend, family member, like I get really protective, but sometimes I have a hard time doing that for myself.
Yeah,
So it's really great to think about like love yourself like you love other people,
that's
and
great.
defend yourself, stick up for yourself too. Like it's good because it's I think about that sometimes. I'm like, would I let, someone do that to my mom or my dog or whatever it is? And I'm like, no, like I'm not, then don't do that to me. Like I gotta love myself like I love other people. It's great.
Funny because like no one wants to be yelled, like no doctor wants to be yelled at by like a five, like a tiny Asian girl like in the hallway. I'm like, come on, like let's talk about this. They're like, oh my god, and my charger is just like, relax.
But
I'm
you
like, I
come
have to get my point across.
you come from like thinking that that's where you were going to go originally, like going back to what you were saying earlier about how you thought you wanted to be a doctor and the med school route and all of that. So I think you kind of, it's funny because I talked to people who a lot of people thought that they were going to go in and maybe become a doctor or something like that, and then they realized nursing was for them, and vice versa. Sometimes people went in thinking they're going to do nursing and decided, oh, I actually want to do the doctor thing. It's just very interesting roles, how one really speaks to you over the other.
Definitely.
And you know what I also love about nursing that we didn't really cover too much was just the fact that there's so many avenues and so many things you can do, different specialties, ways to keep advancing your education if you want to. Like it's endless. It's absolutely endless with all of the knowledge that you accumulate, and then that knowledge you can keep and use just for the other position that you're doing. Do you have any, I know oncology is for you, that's where you're at, but do you kind of see yourself extending education or anything down the line? Or are you pretty much like, this is where I'm set?
Well, no, I have been putting off going back to, I love school. Like I've been putting off going to grad school just because I changed my mind quite a bit. And it took me about 4 years to figure out what I really want to do and what I really enjoy doing. But I plan to get my doctorate, and then doing like a dual fellowship in both oncology and palliative care. Because palliative care is a very big specialty, but I want to stick solely with cancer patients.
Yeah, so can you explain what that specialty is for anybody who doesn't know? Okay.
Yes. So palliative care it's kind of a broader term. It pretty much focuses on symptom management, quality over quantity. But a lot of people interchange palliative care and hospice, which is not accurate. Palliative care is an umbrella term. It includes hospice, but hospice is very specific. In order to qualify for hospice, a patient has to be, have a terminal illness of 6 months of life expectancy or less. But palliative care, anyone with a complex disease can qualify for palliative services. So it's a huge, range of diseases. Cancer is obviously one of them. But it's one of those services we do. We do a lot of symptom management. We besides just doing medication, and we can connect patients with like integrative medicine. To do alternative medicines. Alternative therapies for patients who may be a little bit more, tired of just medicating and medicating. We have other options for them. We deal with, we help patients with spiritual issues, emotional, psychological, it's a very umbrella term. Pretty much our job is to make sure that, we're maximizing their quality of life. The medical team focuses on the quantity, but we focus a lot on quality and making sure that they have everything they need, all the resources they need, all the resources the caregiver needs to, make sure the patient is comfortable.
Yeah, it sounds like you're focusing on like the whole entire person, not just the disease or the thing you're trying to fix, but also like the mental struggle with it and the maybe like nutritional symptoms of it and like all the whole just the whole package of all of the things that can go wrong and that we need help with when we're going through something so stressful
Exactly.
in our bodies. I love that. I didn't even know that was a thing, but that's really great to know.
Yeah, I mean it's definitely an underutilized specialty. I think part of my goal with my social media account is to make people more aware of what palliative care is and to kind of dispel the rumors that palliative care is only hospice. There's a lot of education that needs to be done because I think we can't even say palliative care anymore without patients becoming anxious. They think that okay, like palliative care means I'm dying. Like no, no, no. Like hospice, yes, but like palliative care, we're here to help you cope. We're not here to, be like everything's done. Like no, no, no. And I think, in hospitals, they consult palliative care inappropriately all the time. They only consult end of life, which there needs to be work there too. But yeah, I think as nurses, it's really important for us to kind of, explain, the difference to patients because, at the end of the day, we want to see the patient succeed as well. We have to deal with the brunt of the symptoms, and, a lot of the emotional aspects and, palliative care can be very beneficial for them.
Well, thank you so much for sharing that, Emily. Thank you so much for joining our MDF Instruments Crafting Wellness podcast. It's been such a
My pleasure.
fun. And we're gonna have to, I think we're gonna have to do another one with your best friend who's also named Emily. I mean,
Perfect.
two awesome Emily nurses, both in oncology, one adult, one pediatric. I think we need to do a yin and yang duo.
Oh, totally.
And we'll have some more fun, but it was such a pleasure having you on. And I'm really excited to just see all the great things you're going to do and follow your journey even more on social.
Well, thank you so much for having me. I really, I enjoyed talking with you, and yeah, it's been a pleasure.